I'm Jessie. I'm 49.
I'm Sharon. I'm 53.
My name is Sonia. I am 36 years old.
Hi, I'm Britta. I'm 44.
Welcome back to Interwoven's 5th season, featuring conversations and celebration and support for women in middle life. This season, we're thrilled to share support with Vibrant Body Company. Vibrant Body is setting the clean standard for women's bras, tanks, and underwear. With certified clean materials, their wireless bra is so revolutionary, it has its own utility patent. Not to mention, the most comfortable bra you will ever put on your body. Our first episode of the season features Dr. Mo, a breast surgeon, educator, entrepreneur, media personality, farmer, philanthropist, and contributor to the Interwoven Breast Health Guide. Rebecca and Theresa had the opportunity to talk with Dr. Mo about her approach to breast health, shifting our thinking when it comes to caring for our bodies, managing the effects of perimenopause and menopause, and the powerful connection between mind, body, and spirit in promoting overall wellness. With this project, we are creating space for women to share their stories. It is not meant to diagnose or treat a medical condition. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding your health and well-being. Thank you to Gina Barrington for providing the Interwoven music. Remember to hit subscribe so you can be the first to know about new episodes, and visit our website to join the Interwoven community, receive newsletters and event information, access all of our resources, and connect with us on social. Find us at interwoven.com. That's INTERWOVXN.com.
I am so happy to introduce our Interwoven guest, Dr. Monique Gary, also known as Dr. Mo. Dr. Mo is a breast surgeon, educator, entrepreneur, media personality, farmer, and philanthropist. And through all facets of her work, she is leading a movement to achieve true health equity by helping communities develop integrative care for wellness. And along the way, she encourages people to discover their own gifts in order to make this world a better place. So Dr. Mo, can you tell us more about your background and your path to this profession?
Well, first, let me thank you for inviting me to be on this amazing podcast talking about this incredibly timely topic. You know, my path seemed to me a little circuitous, but when I look back and reflect on it, and when I talk to people about it, especially young people who are pondering careers, it all seems to line up and make sense. And I think that's a really important message in and of itself, is that it might not seem like it all makes sense, but in the end, it all kind of does. My path to here really started, I guess, being a little girl watching my mother, who was a nurse. She worked nights at a nursing home. My grandmother was a nurse. And I come from a family of healers and nurses and caretakers. I knew that I wanted to go into medicine, but I wasn't sure in what way until my mother had ovarian cancer. She was 29 and she had her 2 daughters, and she died before her 30th birthday. And so cancer kind of picked me. And from there, I watched my grandmother really, retreat and go through her life feeling that loss and feeling that strain and that stress. And she subsequently developed breast cancer, not just in one breast, but in the other breast as well. And so watching the toll that cancer took on my family in particular, and the way that it changed the entire trajectory of my life, made me inspired to desire to help those who had cancer and maybe alter that trajectory just a little bit. And so that's what I get to do, yes, through surgery, but also through the advocacy work that I do, and through the mindset that I'm really hoping to cultivate in patients, to allow that cancer diagnosis to be a pivotal moment and a tipping point towards something else and something greater in their lives. So I feel really blessed to be able to do it.
It's such a powerful story, and just how sort of the roots influence the trajectory of your life and your profession and the work that you're called to do. And I think in first coming across you, we could feel all of that. And one of the reasons we were so excited to connect with you and to create the Breast Health Guide is that I think we really share a passion for wanting to make health and wellness accessible. And we loved that when we saw the things you were saying and the work that you're doing, that it wasn't just about being in surgery, which is life-saving and so important, but also about wellness and how can we support women in empowering their own health journey.
Rebecca, yeah. I think it's such a huge gap, right? When you look at what's going on today and how we're working with women to feel better about their lives, like the work that you do with Interwoven to really address that particular subset of women, those of us who are women of, I'm going to say women of a certain age, right? And we're at a point in our lives where we don't get a lot of validation about what's going on with us. It's a lot of what to watch out for and a lot of focus on other people, namely our children or our aging parents. And we're, they call it the sandwich generation, right? Of people who have to focus on everything and everybody else except for us. And nobody normalizes what's going on with us and really gives us a soft place to land. And that's what I get from you and the work that you do in Interwoven. And, you and Theresa are doing just amazing work in that regard. And it was a natural fit because you live it and you feel it and you mean it. And you want to give women meaningful guides, not just for when they have an illness, but for life,
Right. It's all about normalizing the changes that we experience in middle life because we're not set up properly to traverse them. And so it causes so much anxiety or not even knowing kind of where to start. So I know one of the questions that we had for you were, what are some of the normal breast changes that occur after 30?
Okay. Yeah, I love this question because it dispels a myth, a huge myth that your breasts stop changing by the time you reach your 40s or menopause or however you want to say sort of midlife for you. We all kind of have sensed it, but we didn't know what those changes are. So it's really important to know that as we lose estrogen, as we get closer to menopause, into and through menopause, our shape can change. Our nipples used to kind of be a little bit more protruding, and many times afterwards, they kind of flatten out a bit. And I have some women come to see me and say, oh, my nipples are inverted. No, they're not inverted. They're just not as protruding as they used to be. They just flatten a bit. We lose sometimes the projection. Some women, their breasts get a little bit more, the technical term is ptotic, right? It gets a little bit more droopy. The shape can kind of change. The loss of estrogen really contributes to, or I'll say the cessation, right? The stopping of estrogen, because we're losing it, but it's a normal loss. It's not like we're losing something that we needed to have and to keep forever, right? If we were meant to have estrogen forever, we wouldn't have menopause. We would just keep going and have estrogenic cycles. That change triggers the atrophy of the glands, the milk producing glands in the breast. And so when we lose some of that glandular tissue, that tissue gets replaced by fat and our breasts become fattier. And this is for many women, but not all women. And I think that's an important thing to discuss as well. I saw a woman who was 78 years old today and, looking at her mammogram was like looking at a snow cone. Couldn't see a thing. She had extremely dense breasts. And so for some women, they'll have less density. They'll have more fatty tissue. For other women, they may retain that density, but the shape of their breast might change a little bit. So those are some of the changes. Our milk ducts become a little bit less tight and a little bit more, I'll call them floppy. It's like the difference between a guitar string and a fettuccine noodle. Right? Guitar strings nice and tight and the fettuccine is sort of floppy. And when that happens, that is what causes some of those changes in the nipple. And it's what can cause sometimes a little bit of clear nipple discharge. The hot flashes, sometimes mood swings associated with menopause, those hormonal changes can also cause us to have breast pain that is unexplained. And people are thinking, well, what do you mean? I had that when I had my period. And now, my menstrual cycle is almost gone or it's coming in for a landing. Why am I still getting these pains? It's because as we go into menopause and through menopause, our estrogen can spike, and that can lead to sometimes discomfort and these sort of shooting pains in the breast. So it's important to normalize those things for women.
One quick thing I was just going to say for myself personally. So I'm 46 and kind of in the transition definitely of perimenopause, but I feel like for me, I'm sort of in this phase of, like you said, that estrogen spike where I have maybe more estrogen dominance. And I'm actually kind of going through a phase where my breasts actually feel like fuller and bigger than they were before. And so it is so interesting how kind of as we have those hormonal spikes that we see those shifts, right? So I'm finding a new relationship even at 46 with my own breasts.
And it's a lot less predictable because at least we used to be able to predict our menstrual cycle. Right? We kind of knew every 28 days, we knew what was going to happen and we could tell when it was happening and about a week before and you had some context clues. And now it's like, okay, I'm hot one minute, I'm cold the next, my breasts are achy and now I feel full. And then, you kind of don't know what's happening as your hormones are doing some interesting things. But the most important thing I think for women to know is that is all really quite normal.
And that's, I think, sometimes what we need to hear. Like we can hear it from each other when we share that story and the other person says, oh, I have that too. But beyond anecdotal stories, we're not always given a heads up on what to expect as we move forward. Back to the breast density. I recently saw my doctor and we had my wellness exam. And after a breast exam, she said, "Oh yeah, your breasts are much denser now. So it would be really helpful to get a mammogram." And I was like, okay, sure. I didn't think to ask, what does that mean? Why would that help? Why is that a thing? First of all, what is breast density? And then why is it now the time to get a mammogram?
Love this question, because breast density means three different things to three different subsets of people. To the patient, breast density is whatever somebody tells you it is, and you're like, okay, my breasts are thicker, they're heavier. I don't quite understand. To the doctor who's maybe doing the breast exam, they're referring to the thickness and the way the breast feels, the texture of the breast. To the radiologist, who is the person who determines what breast density is and how dense your breasts are, to the radiologist, it's the amount of glandular functional tissue that shows up white on your mammogram. So think about it like, well, I'm getting up there in age, and so I'll use the example of console TVs. Remember those TVs? My grandmother had one, and you had static and bunny ears, and the snow on the screen. The more static you got, the harder it is to see the picture. The more that white stuff, right? And so the more density you have, the harder it is to see what's going on in the tissues. And it's like looking at clouds in the sky and trying to see raindrops, right? It all looks kind of white. We're looking at clouds, trying to see more clouds, which clouds are thicker than the other clouds. And mammograms are designed to do that. They're based on density. They look at the thickness, the way an x-ray looks at a leg and a bone. You see the whitest, thickest thing. The bone is the densest thing, so it shows up the whitest. Radiologists will determine how dense your breasts are, how much of that stuff you got. And then there are categories of that density. So category A, B, C, or D, sometimes you'll see it 1, 2, 3, or 4. Category D means that greater than 75% of your screen has snow on it, and it's getting hard to see the picture back there. And that determines the fact that you might need supplemental imaging like an ultrasound. 50 to 75% is category C. You got some static, but we can still see the picture. You know, People's Court, Sally Jesse, whatever, Murder, She Wrote going on. I'm going back to my 80s references again. But you can see the picture, but you got to adjust the antenna a little bit. It's got some snow. 25 to 50%, a little bit of static. Less than that, fatty breast. And the fat shows up the darkest or the most able to see through. And so when somebody says you have fatty breasts, it's not an insult. They're not calling you fat. On a mammogram, that means we can see through it because it's dark. And that's a good thing. The density to us, to breast imagers and to breast doctors, means how much of that glandular stuff you have. And that's determined by your imaging. Now, when the doctor gives you an exam and says, oh, you have dense breasts, that means your breast feels thicker. It doesn't always refer to how much density. And I see a lot of women are really confused by that, because they'll come to me and they'll say, what do you mean I don't have dense breasts? My doctor's always told me I had dense breasts. And I'll say to them, that's because it feels thick. It's not how much of the actual functional glandular tissue you have. And the way to understand what I mean when I say that glandular tissue is to think about a sponge. Like think about a loofah sponge. You got the really big holes and the little tiny fibers. And so in the holes, the big holes, lots of fat, less fibers. You get one of those nice natural sponges you're going to wash with. You got a lot of fibers and little tiny holes. You got more density. And so there's less of that fatty tissue and there's more fibers there. And so the glandular tissue in the breast is kind of like that.
Oh, how I love analogies in healthcare. Those were fantastic. I totally thought breast dense equaled fatty tissue. I learned something new for sure today. I had a similar thing. I went for my first mammogram, which is always a little nerve-wracking, right? Because luckily it was sort of same day. So they came back in and were like, we're going to have to do an ultrasound. Luckily, everything looked okay. But I think a lot of women too don't really know kind of what to expect with a screening, or if they do get called back for additional imaging. Now my experiences since my first have been something where it's read later and you would be called back at a later date. And I hear from a lot of my patients or friends or women just like how nerve-wracking that is when, they don't really know what to expect. So could you maybe walk us through the basics of breast screenings and the current recommendations? We think that there's also a lot of confusion about that, and it's changing, right? Or there have been some changes.
It is actually so confusing right now. And it's like, who's on first? I think that women should know that the first thing you should know is that screening means we don't feel anything. We're not looking for anything. And this tripped up a lot of people during COVID, because during COVID, we told everybody shelter in place, don't go to hospitals, don't get your annual screening. And so they didn't come in for issues, for problems, nipple discharge. They felt a lump. They said, oh, I'll just wait. That would have been diagnostic imaging. When you feel something and you're going in for a reason, they will look at it right away. They will read it right away. Sometimes they'll even biopsy it right away. Screening means you're not expecting to find anything. And it also means that you have to a lot of times wait to get your results, because that means it goes into a queue and the radiologist will read it later. They'll send you a letter, or they'll call you and say everything looks good, but you got density and we want to bring you back and do a little bit more, or we just kind of see something and we want to take a closer look. So that's the difference between screening and diagnostic. Really important. If you feel something, you got to see your doctor, get a diagnostic study. They'll read it right then and there, and they'll do the secondary imaging. In terms of the guidelines for what people should do, the guideline that I follow is called the NCCN, the National Comprehensive Cancer Network. It's sort of the cancer Bible that most of us follow who participate in cancer care. The next guideline that I look at is the American Society of Breast Surgeons, because we see breast cancers every day, and so we deal in this. Guidelines like the U.S. Preventive Task Force, which we saw a lot of controversy about 2-3 months ago, right? Katie Couric, and they made some recommendations about women starting at later ages. The recommendation that I think women should follow looks a lot like this, to keep it really simple. You should start at age 40 for women at average risk. Now, whether or not you know you're at average risk, we can answer that question in a minute. But for women at average risk, you start at age 40, and you should go every year until your life expectancy is less than 10 years. So if you're 90 and all your family lived to be 110, chances are you might be 90 and wearing lipstick and driving, and you still might want to go ahead and get that mammogram. You can talk about it with your doctor. It's on an individual basis. I'm not saying you should get a mammogram at 90. Don't misunderstand. My point is that for women at average risk, you should start at 40. You probably should go every year. When we start to skip years, well, then they don't have anything to compare to. If they see something, they're going to say, well, it wasn't there last year, or you didn't get your mammogram last year, and we don't know. So now we got to do more imaging, and it can create a sense of anxiety for women. There are other guidelines that say you should start at 45. There are some that say you should go every other year. I find them very confusing. I think that a mammogram is a study that relies upon changes over time. And in order to track those changes over time, the safest thing to do is to get one every year, so that you too can track those changes, so that the AI, the artificial intelligence, and that radiologist will have something to compare. So if something is developing, we'll be able to see a series of images to detect that better for you. On the subject of risk, all of the guidelines are really for people who, have average risk. But if you have family members with breast cancer, especially first degree family members, you might not be at average risk. First degree, mother, father, sister, brother. If your sister had breast cancer at 54, you might be at elevated risk. If mom had breast cancer at 36, you are probably at high risk. And you should start screening 10 years younger than the youngest person in your family. So it's really important to know that family history. So try not to get confused, but think of 40 as that magic age where if you don't have any family history, you should be talking to your doctor. Is it time for me to get a mammogram? But if you do have family history, you got to know what age, and then start that screening 10 years younger than the youngest person who had breast cancer, so that you can begin to look for those changes earlier in life.
I want to jump in real quick. So my aunt, my mother's sister, was diagnosed with aggressive breast cancer. Within months, went in for a double mastectomy, and is now undergoing chemo. Supporting a family member, someone you love, through something like that. What are your tips for that?
It's tough because, one, you're experiencing it too, even as it's happening to them, and that I'm going to call it devastation, because it is, right? It's devastating watching your loved one go through cancer care and going through chemo. You have to somehow try to put that, I'm not going to say aside, but put it in perspective as you consider the needs of that person. And so I'll give you an example. I have some patients who, cancer for them was a little bit of a clarion call to make some lifestyle changes. And so they really wanted to change their diet and be more plant forward. And they wanted to really try to focus a little bit more on exercise and the stuff that they could do to just try to feel better and to take some charge of their life. And all their family members kept bringing them comfort food. They had mashed potatoes and mac and cheese and like all this stuff. And, one of the patients, she said to me, I got a freezer full of food that I just didn't want. I didn't eat it. And I don't know how to tell my family that wasn't what I wanted. I just wanted wanted a salad and I wanted somebody to watch the kids so that I could have a little bit of time to go for a walk. And so I say that to say showing up looks like asking that person maybe what they need, or maybe offering some things and having a discussion about what it is that would help them to feel supported. And if they're not able to tap into that, or they don't know, or they're just kind of, sometimes our loved ones just keep trudging forward, especially as women. It's kind of what we do. We put our purple cape on and we don't ask for help. It looks like showing up in some ways and being okay with the feedback that maybe it wasn't the most helpful thing. Sometimes it means making jokes and just treating a person like they're going through a life experience. And, it's one of many. If her life is a book, this might get a chapter or two in the middle, might not get the title. Right. And leaving it in that perspective helps her to know her life is far more interesting than this one thing, this chapter in life. I think the answer to that is different for everybody. But the most important thing you can do, one, is show up. And two, show up authentically. And three, check in and see and be flexible enough to know that, today she needs strength. Tomorrow she needs vulnerability and a space to be vulnerable and to be able to be flexible in all those things while still honoring your own feelings and making sure that you're journaling and making sure that you have an outlet and you have something for yourself too. It's very important, and it's hard even for spouses and partners, right? Because they too are in it, and there's very few handbooks and guides on how to be the best partner or spouse during the time of somebody going through cancer care. But it very much is remaining vulnerable and remaining present, just tapping into that person and what they love, and being that loving, supportive force that's flexible enough to be steadfast, but also to be bendable.
And we are going to take a quick break to talk about bras. Do you hate your bra? As I get older, I only want to wear something that looks and feels great, which is why I'm so excited I found the most comfortable and clean wireless bra from Vibrant Body Company. Every component of the bra has been designed with a woman's body in mind and tested to ensure it's free from potentially harmful levels of chemicals. They even offer free virtual fittings with their master bra designer. I was shocked at how off I was on my actual size and what a difference the right fit makes. Interested in trying one for yourself? Get 20% off your first purchase with the code BRALOVE20 at vibrantbodycompany.com.
I know how I want to show up sometimes, but it might not be what that person needs. I'm kind of a tough love kind of person, surprisingly, as nurturing as I sound. When it's my loved ones, I'm like, come on, we got this. And sometimes people just need a shoulder to cry on, and just to say, you know what, it's okay to be down about this. And this sucks. And I'm sorry this happened to you. Let's set up something that you're going to look forward to. Let's get some tickets to a show you really want to see. Let's make a plan for what happens after this and give them something to motivate them.
You talk about building a partnership with the people that you see, with your patients, that it's a partnership for you because you are present with them, you are listening to them and using that information to move them forward health-wise.
I think it feels powerful to know that your doctor is able to be a little bit vulnerable with you, in the sense that I use my patients sometimes as accountability partners. I can't tell you to do things that I'm not doing, but I am telling you to do things that I'm not doing. And so now I need you to hold me accountable. Okay, you're going to get on your bike. Guess what? My recumbent bike's holding my dry cleaning. And so over the next 6 months, your mission, should you choose to accept it, is to X, Y, Z. What are your goals? Okay, well, mine are, I'm going to move the dry cleaning. I'm going to get on that thing at least twice a week. And when I see you in 6 months, ask me about it. Yeah. And all of a sudden, now we're accountable to and for each other. And it's a partnership. And that's what healthcare should be, right? Like, that's the ultimate contract between people who are just trying to live healthier lives and take care of each other. And if you got to ask your doctor how she's doing with her such and such. One, you're going to keep that appointment. Two, you're going to do the thing because I'm going to ask you in 6 months how this is going. And it becomes a fun little game instead of a chore of whatever it is that, we think this wellness thing has to be. I find that we put a lot of weight on it, and we expect it to happen naturally and easily. And it's such a gradual process that you almost miss it,
We love your approach to health and wellness, and it just makes me so happy to have this conversation. As an acupuncturist and Chinese medicine practitioner, I work with the interconnectedness of all of the things, right? Our cycles, our hormones, and how the whole of our mental and emotional health can affect the parts. So commonly as women, I think when I've been sitting this week with my own relationship to my breasts, for example, or as women, how breast health or our breasts sort of come up in our life, there's so many thoughts, whether positive or negative, around our breasts, their appearance, their function, whether or not we might be someone who's at risk for breast cancer. But we don't necessarily think about caring for our breasts in a holistic, preventative way. We are also really excited to chat with you more about some of the things you're excited about when it comes to self-care for breast health, diet, lifestyle, things that can improve overall health. Because I think a lot of times women don't really make the correlation that those things affect their breast health in the short and long term.
I think that the biggest thing that people can do, and I guess the biggest disservice that we did as a medical community regarding breast health, was we told people, feel for the lump, check for lumps. And how many times do you see the card that says check for lumps? And then you check for a lump and you find one and you're like, oh crap, I found a lump. And instead, we really should flip this thing on its head and tell people to check for normal, because if you look for lumps, you will likely find them, but they're probably normal. If you look for normal, you will start to normalize the concept of, my breasts are probably going to be lumpy. Let me check to see where they are, and are they in the same places, and do they feel the same? And then you start to get into a little bit more kind of granular detail on the nature of those lumps. Are they soft and squishy? Do they feel like, I use a lot of food analogies and other things, do they feel like bubble wrap, right? Do they feel like cottage cheese? Do they feel, like clumpy rice? Do they feel more firm, like a popcorn kernel or frozen pea? And some of those harder lumps are more concerning. I think that we have to normalize that relationship with their breasts, because many women come to see me, you know what, I ask them, have you noticed anything different in your breast? Oh, I don't do that exam. I don't do a breast exam. And it's because they feel alienated from these. These are functional things that they don't quite know how they're supposed to feel, what they're supposed to do after breastfeeding or beyond that, or beyond pleasure in an erogenous zone. Maybe there's no sense of what they are to you, maybe just to someone else even. And so we kind of need to spend a little time just getting to know our breasts. And, when you're in your shower, you get some warm water, get some good soap, and start feeling, what's the texture? What's the consistency? Where are the lumps? How do the nipples feel? How do they feel to me? What about underneath my breast? What about in the corners of my breast? How about my chest wall? All of that from underneath all the way up to the collarbone is all breast tissue. And it feels different at different times in our month. It feels different at different times in our stress levels. It feels different standing up than it does laying down. And so the goal really with self-breast exams is to normalize what we call self-breast awareness. And like, everybody's not aware of them, but being aware of how they feel at different times in different states. And that comes from touching them. And so we really have to spend some time with that. 2, we got to understand that our breasts typically may be lumpy. It might be your normal. And many women who have fibrocystic changes, those lumpy, bumpy changes, their parents had it, their aunts have it, and it's a normal thing. But where are they? And are they symmetric? Symmetry in breast exam is one of the most important things. And it's not to say that they should be exactly the same. One nipple's always doing something different. And, they're twins, but they're never identical twins. But generally speaking, you feel a lump, it feels, kind of firm and lumpy on this side. It should feel the same on the other side. And so start to be okay with feeling things. And I think we have to change our thoughts on that so that we can have a better relationship with what normal is. So when something's not normal, you'll have muscle memory and your hands are going to know, and your imaging is going to catch it if it's too small for you to feel, right? Because you're doing your screening, and then you're doing all the other things, Rebecca, to your point about self-care, the other things that you can do to optimize your wellness so that if something's found, your body's in fighting shape to be able to get through it, right? But you're optimizing your body for wellness so that your cells and your body can detect the mistaken cells. That's really what a cancer is, right? It's an abnormal cell that goes rogue, and 1 makes 2, 2 makes 4, 4 makes a million. Now you got a tumor. Our bodies have a mechanism to try to prevent that from happening, and we can work on that, right? It's not to say that our bodies can heal a cancer without the therapies that are available to us, but our bodies can recover from all the therapies and what they do to us. And so it's shifting that focus, to feeling more empowered. And I think that's probably one of the most important things that we can do in our self-breast exam. We're not just sitting ducks feeling for lumps. We're getting to know our bodies. And then in our focus on wellness is like, okay, what can I do to keep this machine? This is the one I got. This is my Toyota or my Tesla or my whatever kind of car. It doesn't have to be a car at all, but this is the body that got you through every single thing. Every date, every disappointment, every childbirth, every scraped knee, right? Every accomplishment, every disappointment, this body. And you honor it and you get to know it because this is the one we got.
What are the red flags that women should be aware of?
There are red flags, absolutely. Nipple discharge, spontaneous nipple discharge. If you squeeze your nipple really hard and fluid comes out, that's pretty normal because our milk ducts always have a little fluid, just like our mouths always have a little saliva in them. So if you squeeze really hard and fluid comes out, chances are that's normal. But spontaneous nipple discharge, if you wake up and your shirt, has a stain, especially if it's bloody, but even clear nipple discharge that's happening on its own should be checked out. Dimples in the shape of the breast. If your breast, kind of was smooth and now all of a sudden there's a dent or a dimple or a lump that's sticking up, those types of visual changes are really important to know, and those are red flags. Nipples that are inverted, actually going in and not coming back out. Not just a flattened nipple, but if it's pulling in and you go through your day and it doesn't come back out, because a lot of times women, their nipple may invert if it's cold and then it'll come back out. If it's not coming back out and it's only happening on one side, that's something that should be checked out. Changes in the color. Sometimes I'll say redness, but in women of color, it doesn't always look red, and the changes in things that are concerning for inflammatory breast cancer are going to look kind of like a mosquito bite. You know how the skin gets thick and you can see every single pore, especially after you scratch it a little bit, that type of thickness of the skin. And I'll call it a redness of the skin, pinkness of the skin, but it's not itchy and you didn't do anything to it. If that skin texture and color and thickness starts to change, those are things that are concerning for breast cancer also. And then, of course, if you feel a mass, feeling new masses, so something that wasn't there before, particularly if it's hard. I say popcorn kernel, frozen pea. I use dumplings. I use gnocchi. I use spetzel, like anything that's in there that shouldn't be in there, that wasn't in there before, and it's only on one side, is something that's worthy of at least getting further evaluation for. The thing about wellness, I kept asking my partner this morning, I'm like, am I skinny yet? And she's looking at me like, really? And the reality is, you lose it so gradually that until you've lost some inches, it's kind of hard to know. Wellness is kind of like that, right? Your sleep gets a little bit better and a little bit better. And next thing you know, you're sleeping through the night. Your diet changes a little bit and a little bit. Next thing you know, your cholesterol's down. But it's hardly ever this dramatic shift that I think we try to make in our minds. And by we, I mean me also, right? Like I do it too. And it's the daily repetitive choosing of something different, choosing to start a new habit, choosing to eat a little bit better. That commitment, I think, is truly what wellness is. It's the daily double down on doing this thing that's going to help you feel a little bit better, resisting the urge to maybe have those cookies, or saying, you know what, that'll be my weekend snack after a week full of all this. I'm going to enjoy that chocolate chip cookie. But for now, I'm going to eat a little bit of protein and I'm going to drink my whatever. And I'm going to move a little bit more because I know how I want to feel, not just how I want to look in my clothes, but I know how I want to feel. I know I don't want my knees and my joints to ache. I know I don't want to wake up with a headache. If I drink this alcohol, I'm going to, wake up with a headache tomorrow, and I want to be hydrated and I want to feel my best. I want my body to feel its best. That's an expression of self-love.
I feel like in some of the back and forth that we had done, some things came up with some kind of tips for managing negative effects of perimenopause and menopause on the breasts, or even just, you mentioned alcohol right now. Like, is there anything kind of from a food or dietary standpoint or anything that you recommend to patients or have been shown to be detrimental to breast health?
Ooh, so detrimental to breast health. Let's say it this way. Detrimental to all health, including breast health, definitely increased alcohol intake. The recommendation for cancer risk reduction really is like less than 3 drinks a week. You're creeping up into 5. It's probably too many. many. The reasons why, well, one of the key reasons, we don't know all the reasons why alcohol contributes to things like breast cancer risk, but it gets converted to estrogen. And so estrogen is a growth factor, it makes stuff grow, and it can contribute to things like breast pain. So you want to limit your alcohol intake for sure to decrease your risk for cancer and other chronic illnesses. Stress, right? When we are stressed out, our hormones are all out of whack. Our cycles are all out of whack. Our sleep, our diet, everything gets thrown off by stress. And so managing stress is really one of the biggest things people can do, because I can't say don't stress out, right? Like, who doesn't have stress in their life? We all have it. But we're getting to a point in our lives where we need to figure out, what are the tools? What are the coping mechanisms? What are the things that work for me to help me de-stress? And if you don't know, then today is your day and tomorrow is too. And you get to try to figure it out. It's not to say you got it all figured out, and what you do today and tomorrow might not work next week, depending on the stressor. But committing to decreasing stress will definitely improve your breast health. If you are having side effects of menopause on your breasts, decreasing your caffeine intake. Caffeine has been shown to increase those. I know, right? I love my caffeine. And this is what I tell patients. If you don't have breast pain, fine. Keep drinking your caffeine. But if you're having breast pain, decreasing or stopping your caffeine is one good way to see if that will help. I have some patients, they eat a Hershey's Kiss and all of a sudden their breasts are exquisitely tender. So no Hershey's Kiss for you, right? You got to figure out what works for you. But if you're having a lot of fibrocystic changes or perimenopausal breast pain, I would do that. Salty food, fatty food also can increase those changes in the breast. So decreasing those things and trying to have a bit more of a clean, plant-forward diet. And I don't say plant-based because, it's not for everyone, but plant-forward for sure will help to increase antioxidants and rich minerals and things that can really help you to have good breast health. The older we get, we start to really, I think, desire to wear less tight-fitting clothing. Although some women go the opposite direction. They want to show it off because they still got it, and I respect it, and I can appreciate it. But if you're having breast pain, you want to think about your garments and making sure that you have a good fitting bra. It's a great time to go to a store where somebody's got a tape measure and they can fit you for a bra that actually fits, that actually gives you some support. Whether you choose to wear underwire or not is a personal decision, but you certainly don't have to. There are enough non-underwire options that will give you some lift and some support if underwire is not your thing. But it's the cup size and the band width. We are almost always wrong in one of those areas. You either got a good fit around, there's some circumference, and your cup size is wrong, and you got the double bubble thing going on, or you got the wrong width and your cup size is good, but it's digging in and it's not fitting well in other areas. And that too can contribute to breast pain. It can make you feel uncomfortable in your body. And, we women of a certain age, we want to feel good in our bodies. So you got to make sure you got a good fitting bra and get fitted for it. And then keep cool. If you're having those perimenopausal changes and spikes in temperature, hot flashes and things, you got to make sure you wear good clothing that feels good to you and that keeps you cool. Sheets too. Moisture wicking sheets are a thing, let me tell you.
And putting a fan next to my bed has helped as well.
Yes.
I want to make sure we touch on this. We can't let you go without asking more about your farm.
See, some days I'm really proud of it, and other days it's kind of like those decisions in life where you're like, what was I thinking? And mostly I was thinking the right things about thinking about others and also myself, thinking that people want to know what wellness looks like, feels like, tastes like, smells like. They want to have experiences in wellness. And we don't always have safe spaces to do that. And I wanted to especially have a space for people facing cancer and chronic illness to be able to come and figure out what wellness feels like for them. And so Still Rise Farm is a 39-acre, we call it an incubator farm, right? It's a place where you can come and test out the waters and do some different experiential things that hopefully will promote wellness that you can take back to where you live. Our tagline is our main crop is wellness. It's because we're planting seeds in people that we hope will grow where they live about what wellness is for them. It's also that tagline because it was just me running it and we have absolutely no crops. And so now as we start to get some more crops and we have our community garden growing, our main crop will always be wellness. because that's what people need. They need to plant that seed within themselves. So to that end, we have programming a couple times a year so far, and eventually we'll have some ongoing programming that really helps people to put it in perspective and invite speakers and key opinion leaders in different facets of wellness to facilitate those discussions. We have wellness days where we invite cancer patients and survivors to come out, and they'll rotate through different experiences, including things like ecotherapy, managing your gut and your nutrition, and food as medicine. And they'll do little cooking demonstrations as well as a discussion about food and juicing for life. There is an opportunity to go fishing, right? And just kind of be one in nature. There are discussions on sex and intimacy and really rediscovering that or discovering it for the first time. And many times we'll have a writing exercise, including writing love letters to yourself and other ways that you really can process and sort of honor yourself and make a contract with yourself about who you want to be when you leave and what tools and tips and skills you can take back with you. Every woman almost always leaves with fresh produce boxes from the farmer's market, soon to be from the farm itself, along with a cookbook, some resources, a whole lot of sisters, and a network of people who are all just trying to figure it out themselves so that we can really take root in the idea that wellness begins in you and it isn't anywhere else.
How do you find time in the day?
We talk a lot about balance, and it's important, I think, for us to remember that balance can be a dynamic one. It doesn't mean it's always 50-50. Some days it's 70 and sometimes it's 30. And it's okay to give the 70. It's okay to take the 70 as long as you give yourself the 30, right? And it's okay to be in flux, knowing that you're going to be good to yourself on the other side of that. And for me, one of the secrets to longevity in medicine, a lot of doctors are facing a lot of burnout, and they're really struggling with what it means to provide care in a system that doesn't seem to promote wellness. And everybody's just seems like they're sicker and sicker and getting sicker, and there's less time and less resources and more oversight. And the practice of medicine is getting real hairy right now. Doing this work with the farm provides such a balance for me with my clinical life. It makes me feel really well-rounded. And I have something to offer my patients surgically to get rid of their cancer, but I also have something to offer them that can really help them change their lives. And for me, that feels like success. There's so much that we can do in a collaborative fashion because we're so aligned in this work. So I say we look to explore what that can look like, and because it's a blank canvas here and a whole lot of opportunity to do a lot of good.
So many things about what you're doing is just so beautiful. I think we all just feel passionate about wanting to support women on this journey of life. And so we're grateful to have connected with you.
Wow. Well, I am blown away by you and the work that you do in your personal lives and with Interwoven, because it really is a movement. It is taking root in the hearts of so many women, and it's filling a need that they have for reliable information that's well-sourced, that's tailored to them. It speaks to their strengths and it speaks to their vulnerability, and it doesn't make you put on the mask and be or do anything that you aren't. It just says, you know what, these are tools to address you in your life right now. And it's so powerful, even in the simplicity of the concept, that I'm honored to be a part of it and to call you my sisters and co-conspirators for good. More to come for sure.
Ever since we started this, we women are finding each other in this space.
Got that right. It's our time. It is. It's our season.
Any last advice for the women listening who are here in their 30s and 40s?
The parting wisdom, I think, for women in their 30s and 40s, and probably for every age, but especially in our 30s and 40s, because life has kind of taught us by our 30s and 40s the things we thought we could do and maybe didn't do so great at, and sort of like we start to settle a bit in our lives and our expectations for ourselves. And I think we become a little bit more judgmental as our bodies change and as life takes on a life of its own, so to speak. And the advice that I would give is to be gentle with yourself. It is to say sweet things to yourself. And I'm not always the best at this either. But what I will ask my patients sometimes is I'll say to them, okay, tell me who's rubbing you, who's giving you a massage? Is somebody doing something that feels like touch to you in your life? And you'd be surprised the number of people who aren't being touched at all. You'd be surprised at the number of people that aren't experiencing any touch in their lives. And that touch is very important. But then I'll say to them, who's saying sweet things to you? they just kind of look at me like, well, what do you mean? Is somebody supposed to? And the answer is yeah. And it's you, because there's this sort of unconscious record that plays that makes us start to pick ourselves apart by the time we get to be a certain age. And we look at ourselves in the mirror and, I put on these pants today and I'm like, oh, look at my cellulite. Okay. Oh, look at my this. Oh, look at my breasts are sagging. Oh gosh, look at these grays. And we're not programmed to look for beauty in ourselves. We can look for beauty around us, but we're not programmed to look for that. And so you have to combat that, and you have to consciously play a different record. Otherwise, there'll be one playing, the music's playing, and you're not even realizing it. That picks yourself apart. And so I think a huge part of self-care and a huge part of this sort of movement toward wellness has to do with deciding every day, picking something and saying, you know what, I might not like this. Or if you have that thought, you can allow that thought, but then pick something you do like. But boy, my legs look great. But boy, look at my smile. But you know what? I'm really excited about my whatever. It doesn't have to be physical. It can be another aspect of yourself. But saying sweet things to yourself is one of the biggest, best gifts that you can give. And it bleeds over into other areas. And that's the beauty of wellness. There are 8 dimensions of wellness. And if you start working on one, you tend to want to start working on the others, and the wellness kind of bleeds over. So your emotional wellness now becomes, I feel better. Let me get my body in shape a little more. Now you're into physical wellness, and now your physical's working. And next thing you know, your spiritual wellness. And next thing you know, your spirits are good. You're like, well, let me get my money right. Now your financial wellness. Like wherever you start, it's a circle, but you just have to start. And it really starts by being gentle, being loving with yourself, and being honest with yourself. And if there are things you want to change, it's okay to say that too. I hate that I smoke. Okay, well, tomorrow's a new day and we're going to take a crack at it, and we're going to keep at it until we can say something really loving and sweet about ourselves. You didn't start it overnight. You won't stop it overnight. But giving yourself grace allows you to experience and explore wellness and experience self-care in ways that are sustainable.
As you age, is there a part of yourself or your body that you appreciate more?
I'm going to say I really like and I appreciate more than ever my smile, because as I was younger, I always felt like it was too toothy and it was always too big and it was too, and I remember looking at pictures of myself trying to sort of tone it down. Now I know that when I walk into a room, especially with somebody who's terrified that they might have cancer, that they're going to die, the biggest, brightest thing I can do is a smile and a hug. And so now I kind of embrace that smile a bit more, even if it is a little bit too big and you see a little bit too much gums. And, so I'm going to say my smile and my laugh. It's kind of a cackle, a little bit maniacal, but it makes other people laugh and it is infectious, and we need more laughter. So my smile and my laugh.
Ironically, my answer for that question is actually my relationship with my breasts, because I had a really hard breastfeeding journey that really wasn't successful after fertility. And somehow it sort of felt like the final letdown of my body. And as of late, they're looking different. I'm feeling more confident. Yeah, kind of just like sending them some love and re-exploring my relationship with them.
I love that for you, because, they're such a functional organ. They're a glandular organ. And, I don't know the number of times women will come to see me for a second opinion. And some surgeon has said to them, well, you're not using them anymore. You might as well, whatever. If you did decide to do a double mastectomy for cancer, that's your personal decision. It's not because you didn't want them or you're not using them or they're not functional anymore. It's, they're not just for function. And we have such a complicated relationship with our breasts as with the rest of our body because of, external influences. And that's why we really do have to turn inward and spend some time discovering what we love and being gentle with the things that we might not be as proud of, and leaning into that too. Who made you feel ashamed about this thing? Who told you that you weren't supposed to have love handles? Who calls them handles? Who says these things? And deconstructing all those things and figuring out the source of them is where we take our power back. So I love that for you.
This has been such a gift.
You all are just a gem and a blessing.
Thank you so much.
Bye-bye.
Thank you.
Bye-bye.
Thanks for joining us today. We invite you to give us a star review and to hit subscribe for a new empowering conversation each week. Visit our website where you'll find our newsletter, event dates, and other amazing resources. Visit interwoven.com, that's INTERWOVXN.com to sign up today. This show's copyright is fall of 2023. Our Interwoven producers are Theresa Kopak, Rebecca Jankowski, and Jen Gilmore. All original music was created and performed by Gina Barrington.